Good morning. My name is Dr. Alan Basil Peter, and I am a clinical radiologist and medical lecturer at the Department of Radiology, Faculty of Medicine, UITM. Today, our lecture will be on a very important basic topic in radiology, which is on radiation protection. Our learning objectives are to gain knowledge on radiation protection, the risk associated with radiation exposure, radiation dose values of common radiological procedures, avoidance of unnecessary radiation exposure by choosing the most appropriate imaging modality, radiation protection measures, and to understand the principles of imaging in pediatrics. Let's look a little into history. X-rays were first discovered by Röntgen in 1895, who later received the first Nobel Prize in physics. The image on the left is the image of the first radiograph taken of Röntgen's wife's hand. Radiation is the energy traveling as waves or particles and can be divided into ionizing radiation and non-ionizing radiation. Today we will concentrate more on ionizing radiation. Let us look at this image closely. The electromagnetic spectrum consists of generally 7 regions, which are radio waves, microwaves, infrared, visible light, ultraviolet, X-rays, and gamma rays. As mentioned earlier, we will be concentrating on X-rays mainly today. Here is another informative image that shows us the various sources of radiation. As you can see, the medical portion of which there is radiation exposure accounts for approximately 15% and is mainly from X-rays. 10% is from food and drink, 5% from the cosmos, 1% from air travel and nuclear fallout, approximately 30% from the ground, direct radiation from traces of radionuclides in the rock and soil, natural radioactivity in the air, and radioactive gases released from stone, soil, and building materials. So, we are exposed to radiation sources in our daily lives throughout the year. Let us look at the effects of radiation on the human body. There are mainly deterministic effects and stochastic effects. Deterministic effects is where the severity depends on the radiation dose. These are like skin burns and cataract, while stochastic effects is more of chance and there is no threshold dose. And this can lead to things like cancers and leukemia. Let us look at deterministic effects a little closer. Acute disorders are such as acute radiation syndromes related to bone marrow disorders, gastrointestinal tract disorders, and central nervous system disorders. There may also be skin erythema, hair loss, and sterility. There are fetal disorders as well. The late onset disorders are such as cataract and glaucoma. When looking at the stochastic effects, they may be things like leukemia, cancer, and hereditary effects, which increase in incidence of ordinary hereditary disorders. Because of the uncertainties in establishing risk-benefit ratios for diagnostic radiation exposure, the International Commission on Radiological Protection has concluded radiological examinations shall be carried out only if it is likely that the information obtained will be useful for the management of the patient or for improving the health status of the population. Let us look at this slide very closely. It shows the relative radiation dose values for various radiological procedures that involve the use of X-rays. If you look at the first row, you will see that the chest X-ray uses a typical effective dose of 0.02 millisievert, and the skull X-ray has a typical effective dose of 0.1 millisievert, and the dose gradually increases as we go down these different modalities. If you look at a typical head CT, it has a typical effective dose of 2 millisieverts, which is 100 times more than a chest X-ray. And looking at a CT abdomen, which has a typical effective dose of 8 millisievert, which is equivalent to 400 chest X-ray exposures and is also equivalent to about 2.7 years of natural background radiation. Looking at this, we know the typical effective dose of various examinations, and we should try to use the examination with a lower dose if it is possible to attain the answer of the clinical question posed by the referring doctor. This is an important slide. It also shows the relative radiation dose values, and it is a table prepared by the ACR of common imaging examinations. If you look, the first row shows a CT of the abdomen and pelvis, which has an approximate effective dose of 10 millisieverts, equivalent to 3 years of background radiation. And if you look further down, in the thorax or chest, a CT chest is equivalent to about 7 millisievert, equivalent to 2 years of background radiation, while a chest X-ray is approximately 0.1 millisievert, equivalent to 10 days of background radiation. So we should choose the most appropriate examination with the lower dose if it is possible to answer the clinical question we are dealing with. You can also see, like a DEXA scan or bone densitometry has an approximate effective radiation dose of 0.001 millisievert, equivalent to only 3 hours of background radiation. So it is up to the clinician and to the radiologist to come up with the best modality to answer the clinical question in the benefit or for the benefit of the patient. Because exposure to high levels of ionizing radiation carries a risk, should we attempt to avoid it entirely? What do you think? Even if we wanted to, this would be impossible, as Most of the examinations we do, the benefit of the examination outweighs the risk, and this should always be the case. Thus, radiation exposure of personnel and the general public should be kept as low as reasonably achievable. This is called the ALARA principle. What is ALARA? ALARA is a concept that reminds everyone to keep the occupational radiation exposure as low as reasonably achievable. This radiation safety practice minimizes the radiation dose and releases of radiation materials using all reasonable methods available. All studies should be justified, and every study should produce a positive net effect or benefit to the patient. Every study should also be optimized using the ALARA principle discussed earlier. All exposures should be kept as low as reasonably achievable, producing images that are of high quality enough for the radiologist to come to a proper diagnosis. On another note, pregnant patients should avoid exposure to radiation when unnecessary. However, the decision to use radiation should be justified depending on the individual patient's situation. When it has been decided that a medical procedure is justified, the procedure should be optimized so that the dose may be reduced. This means that the conditions should achieve the clinical purpose with the appropriate dose. Now let us look at radiation protection for patients. The dose of an examination can be reduced by using the appropriate technique. The radiological technique or imaging investigation should be selected so that the image is of sufficiently high quality to give adequate diagnostic information. We should minimize repeat examination and also use appropriate radiation protection in the form of gonad shields and lead gowns. The image on the left is of a thyroid shield, while the lower image is of a gonad shield. Radiation protection for medical personnel. There are various methods that can be practiced by medical staff to reduce radiation dose. Firstly, they can increase the distance from the source of radiation. Hence, the use of long exposure cables for hand switch in mobile radiography or the use of remote control in fluoroscopy units. Secondly, they can reduce the exposure time. The amount of radiation received will clearly be proportional to the length of the exposure time and so may be minimized by conducting procedures as quickly as possible. Radiation protection method number 3 is by having barriers or shielding. This is by interposition of a suitable barrier between the source of radiation and the recipient, which will reduce the dose. Barriers may take the form of protective clothing worn by staff or fixed screens around the control area. The image on the left is of the CT scan in our Sungai Buloh campus with an appropriate shield, which is usually made of lead. They also can use a lead gown with a thyroid shield and protective goggles. Here is another important slide. So in conclusion, X-rays are ionizing in nature and are harmful. Thus, the International Commission of Radiological Protection has concluded radiological examination shall be carried out only if it is likely that the information obtained will be useful for the management of the patient or for improving the health status of a population. Another important aspect of radiation protection is dose monitoring. It is usually done using a film badge or TLD badge. These two are the most widely used. They can detect X-ray, beta, and gamma radiation. This is a picture of the badge used at our department. Principles of imaging in pediatrics. It is important to weigh the benefit of an exam against the potential risk of performing an imaging study. Medical imaging can help clinicians in diagnosing a disease or injury. It can also reduce the need for surgical intervention at times. The modality without radiation should be used if it is able to provide adequate information in management of the patient. Keep in mind that children are not small adults. There are specific diseases and illnesses unique to childhood. Children need age-appropriate care. So, how are children different? They have higher radiation sensitivity. They are more susceptible to radiation damage. Identical settings provide higher organ dose compared to adults. Thus, protocols must be optimized. Scanners need to be optimized for pediatric imaging with relevant protocols. Pediatric population have a longer life expectancy. In young adults, high organ dose may increase the risk of radiation-induced cancer in later life. The effects of radiation may take decades to surface. Radiation exposure of different organs and tissues in the body result in different probabilities of harm and different severity of radiation effect. Thus, proper precautions should be taken when dealing with pediatric population or even with young adults. Now let us look at ionizing radiation and pregnancy. We did touch a little on this topic earlier in our lecture. All imaging procedures must be justified, as we discussed earlier, especially those that involve X-rays. First, contemplate if the clinical question may be answered with the use of another imaging modality that does not require the use of ionizing radiation. However, a study may be carried out, if justified, keeping in mind the benefit versus the risk, with the appropriate precautions and optimization of the scan protocol. Elective imaging procedures involving ionizing radiation can be postponed if not essential at that point in time, if the patient is found to be pregnant. In the event that the patient has missed her menstrual period or unsure of pregnancy status, a urine pregnancy test can be easily performed at the department. Let us reinforce what we've learned, some important principles of radiation protection, justification of the examination, optimization of protection by keeping exposure as low as reasonably achievable. Here are some pertinent points to consider when dealing with radiation protection. Is the radiological examination indicated? Radiological imaging must provide benefit to the patient and the healthcare of the population. ALARA principle should be practiced at all times and not compromising the diagnostic quality of the study. As the dose and the risk increases, the benefit should be greater to the patient. Clinicians should proceed with referring the case and discuss with the radiologist first if the examination is indicated and whether the benefit of the radiation exposure outweighs the risk. Are there other safer modalities that can answer this clinical question without the use of radiation, such as ultrasound instead of a CT scan? Some studies require children to be sedated and intubated. Thus, the risk of anesthesia should also be taken into account. Consider the use of alternative techniques that do not require radiation, such as MRI and ultrasound, if it is possible. One should also factor in the availability and also the cost effectiveness as well. Persons conducting and advising on the examination that requires radiation should have recognized training in their discipline. Radiological equipment should be in accordance with the international standards. Tailor examination parameters to the size of the child to minimize dose. Image only the indicated area and avoid repeat and multiple scans. We are coming to the end of our lecture. Here is the take-home message. As you become young doctors, keep in mind all that you have learned with regards to radiation protection. Keep in mind what the referring doctor should answer in order to prevent a wasteful medical exposure to radiation. Has the study been done already? There's no point in repeating a study if it has already been done in the recent past. Do I need it? Undertaking an investigation when results are unlikely to affect the patient's management. Do I need it now? Am I performing this investigation too early? Is this the best investigation? Am I doing the wrong investigation? Is there an option of another modality that can be used that can answer my clinical question? Have I explained the problem? Failing to provide appropriate clinical information and questions that the imaging investigation should answer. The clinician should be very clear with what they want the radiologist to look for and also what the clinical question is in this particular patient. The patient should not be sent for a scan without knowing what the clinical question is, and also in a situation where you do not know the exact diagnosis or what is going on with the patient, it is best to discuss with the radiologist so that the best imaging modality can be chosen in the interest of the patient and for the best outcome for the patient. Remember, we are always working to provide the best for the patient in all situations. Medicine is a teamwork that cannot be done without proper communication. Thus, It is important for us to communicate well, especially with regards to what the clinical question is, so that the best or most appropriate modality of investigation can be undertaken to come up with the clinical diagnosis or conclusion in the interests of the patient. Here are some of the references that I've used. Feel free to scroll or go through them at your convenience. Thank you for your attention. We have come to the end of our lecture. I hope this lecture has been beneficial to you. Please remember what has been taught when you become doctors, and also when you want to request a particular imaging modality. Please do not hesitate to come and discuss any matters with me with regards to this topic or any other topic with regards to radiology. Happy learning and all the best.